How do neighboring states come together to take on an unprecedented pandemic? No, we're not talking about Europe, but West Africa. Hello, everyone. I'm François Picard. Welcome to the France 24 debate. Yeah, from the sanitary challenges of fragile national health systems throughout the region to the sudden squeeze of revenue lost during lockdown, we're going to try to get a snapshot of the situation. After weathering the Ebola outbreak of 2014, is the region more resilient, or with trade and exports plummeting, much more vulnerable this time? In the Sahel region, there's no pause for radical insurgencies during lockdown. And then there are nations where coronavirus could offer an excuse for leaders with an authoritarian bend to bend those rules even further. What response from citizens? What response from the international community? Today in the France 24 debate, we're looking squarely at COVID-19 and West Africa. With us, he's the United Nations Special Representative of the Secretary General for West Africa and the Sahel, Mohamed Chambas. Thank you for joining us from the Ghanaian capital, Accra.
Thank you. It's a pleasure.
I want to also welcome from London, Comfort Arrow, Africa Director for the Crisis Group think tank. Welcome to the show.
Thank you very much.
Also in the UK capital, Franco-Ivorian novelist Véronique Tadjo. Your book, The Whispering Tree, that's a working title, is all about the Ebola outbreak and the lessons learned from that. It was first published in French. We'll talk perhaps a bit more about that later. You're also one of those who signed an open letter to African leaders to use this opportunity for better governance. Welcome to the show.
Thank you.
And joining us from the French capital, Patrick Smith, Editor-in-Chief of the Africa Report. How are you?
Greetings, I'm fine. Thanks, François.
The France 24 debate on Facebook and Twitter. The hashtag is F24debate. Over the weekend, there was this story, Ghanaian authorities stating that one man at a fish processing factory in the port of Tema, near the capital Accra, is perhaps responsible for infecting 533 others. Mohamed Chambas, your reaction to that story?
Well, it was one of surprise and shock, but at the same time, I think it brought very forcefully home the point that we all have to be extremely cautious, that we have to be vigilant, we have to indeed accept the recommendations that have been given by experts about personal hygiene and ensuring physical distancing. So it was a bit surprising that in spite of the strict and rather very prompt measures that had been adopted by the Ghanaian authorities, one person could infect so many colleagues at the factory. But I think it's also a sign that perhaps not all institutions have been respecting the measures that have been put in place to ensure that no more than a certain number of persons, I know that in Ghana the number is 25, do not congregate at the same time. So it was shocking. What is assuring is the capacity that has been established in Ghana for testing. So I think that proved quite efficacious when they were able to detect so many infected persons in this one factory. So this testing continues, and we hope that it will remain something that all will accept and all will cooperate with government for the implementation of these sometimes very harsh measures that have to be put in place for safety of individuals.
For safety of individuals, we're going to talk about that. Comfort Arrow, an important point there brought up, testing. A story in the Financial Times on Tuesday pointing to the fact that in Nigeria, the testing might be severely underreported. There's an official map that's been put out of areas in the country where people have been affected. I think the official toll is something like less than 5,000 people who've contracted COVID-19. Your thoughts on what the true sanitary picture is?
I mean, in Nigeria, at least you're right, about 5,000, have been tested, and also around about 140 or 43 deaths as well. The Nigerian Center for Disease Control, which is leading the national response, has activated a national emergency operations center. There has also been a national rapid response team that is deployed to certain parts of the country, and also the presidential task force is reviewing the situation. But it's quite correct. Right across the West Africa region and beyond, I think our biggest concern has been underreporting, but also the concern is around the capacity of each of these countries to be able to address the pandemic. If you look right across West Africa and into the Sahel, one of the biggest concerns is this is a region that's already facing, various crises, seen huge swathes of displaced people in the Sahel region, many of them facing food shortages. We're already seeing the pandemic mix in with the security crisis in the Sahel, where we're seeing strain on facilities, especially humanitarian facilities. And despite deployment of security forces, armed groups themselves will continue to cause.
Yeah, we'll talk about those armed groups in a minute. I want to bring in Véronique Tadjo because, here in France, there's been this criticism level that for years we've downsized the capacity of the public health sector to respond to a crisis. And now that we have this unprecedented pandemic, we were called out. I know that in that open letter that you signed, the same charge is leveled against African leaders.
Yes, I think that after the Ebola crisis, a lot has been learned, but more could have been learned as well. So we think that there was an opportunity missed there. And I think that it comes very much from communication, lack of communication, and also lack of reforms in the health sector. There is a tendency to go for expensive hospital in cities, and we should have looked at community health services closer to the people. I think that all in all, the lessons have not been learned fast enough.
Ambassador, the lessons learned from the Ebola pandemic in countries that had been directly hardest hit, Guinea, Liberia, Sierra Leone, people seem to be respecting well the public health messages that have been put out since the start of the coronavirus pandemic. But overall, has there been a missed opportunity? Do you agree with Véronique Tadjo?
Well, the missed opportunity is in the fact that over the years, the necessary investments that were to have been made in the public health sector lagged behind targets which African countries themselves had set. You go back to, I believe it was 2001, at the Summit of African Heads of State on Health, it was agreed that the spending of public budget, the target was to be 15% annual spending on the public budget for each African countries. That has lagged far behind. In fact, a recent study that was done by the World Bank showed that only one country in West Africa, that happened to be Sierra Leone, was spending somewhere around 16%. The rest were not meeting that target. But beyond just meeting the target, I agree also with Véronique that we need to emphasize not just big facilities in urban centers, but also spread that spending to communities, to rural areas, and in public health, and in prevention, and in education, and sensitization. So all of this become very important in the outbreak of a pandemic. perhaps the countries of the Minor River Union, because of infrastructure that was put in place to fight the Ebola, are better placed in this particular case of the COVID-19 pandemic. But I should say that on the whole, most of the countries in the sub-region reacted fast enough, quickly enough, and put in place the tough measures that were unfortunately required to prevent an escalation of the pandemic.
Comfortero, there was alarming report last couple of days. For the month of April, 23,000 have fled Nigeria to Niger. All the while the COVID-19 pandemic has been going on, there's been no hiatus when it comes to insurgent attacks, be it in Nigeria or in those Sahel countries. How much of this is up to the national governments to deal with it? What should the international community be doing on this score?
Well, I mean, with or without, I think we should make it clear, with or without the COVID, the insurgencies have continued to escalate. I think one of the biggest challenges is that the pandemic could possibly immobilize government and foreign troops. So already the EU training and capacity mission has already suspended some of its activities due to the pandemic. Both the UN mission there and French Operation Berkane have also looking at ways in which to reinvigorate themselves because of the pandemic. The question, I think, to go to what you're asking, the question I think will be what will happen to future troop rotations, whether by the UN or by the French Operation Berkane. Already, we are hearing that the UN is going to suspend troop rotations to the mission. Also, all country staff movement has been suspended. So there is, although not directly related, there is concern about the future deployment of a Chadian force onto the tri-borders of Mali, Chad, and Burkina. And as you know, there was the idea by the African Union to deploy forces to bolster and to reinvigorate the military external military presence in the Sahel region. So I think there are a number of concerns, and of course the one big concern is whether jihadi groups will take advantage of this. And as the COVID continues to dominate the news, jihadi attacks are occurring. There are also counter-terrorist operations that are fueling human rights violations that are going on, whether in the Sahel or in other places in the Lake Chad Basin as well. So the situation continues to remain tense in the Sahel.
And from what it sounds like, it's going to be less, not more help from the international community, Véronique Tadjo.
Yes, that's one thing that is striking, is that as soon as the pandemic was declared, there was this surge to find more money to help the economic sector. But it makes us wonder how many emergencies we can handle. We've just heard from Comfort about the terrorism issue, and now we have this sanitary issue. It seems that I may be a bit tough, but it seems again that we are not learning. We are not learning, and we are not doing it at a continental level. I think that if there were more cooperations between countries coming up with a united stance, something that would help to see more clearly the situation at the continental level. For example, we've just cited Burkina Faso having problems, Mali, and we can see that it's coming down to the coastal areas. So what are we doing exactly to prevent the degradation of what is happening? And we can't just all the time run to the donors and ask for more money.
Let me bring in Mohamed Mchambas on this, because how much are the United Nations hands tied when you're facing something like this? You heard Comfort Aero talk about the French wondering whether they can do regular troop rotations in the current circumstances. When you have the Security Council, where you have the US on one side, China and Russia on the other, how much can the UN get done when the superpowers aren't talking to each other?
Well, the UN, first and foremost, in West Africa, has focused on mobilizing the entire UN system in each country to support the national efforts. That's very important in preventing an escalation of COVID-19. So they're working very closely with national authorities, national health authorities, and all national entities mobilized in the fight against COVID. Secondly, at the regional level, the UN is working closely with the ECOWAS. I myself had the opportunity to participate in the ECOWAS summit, which was dedicated to the fight against COVID, where a regional joint response of sorts was defined. And in that context, UN has been supporting, for instance, acquisition of the necessary material, medical and otherwise, using UN procurement systems to fast track and also to obtain goods and services at value for money. So ECOWAS Commission, working closely with UN system in Abuja, have embarked on these purchases. The UN is also setting up a transport hub in Accra, one of 4 on the continent. The other will be in Cairo, in Addis, in Johannesburg. And through these transport hubs, we will facilitate movement of medicines and other material needed in this fight against COVID, but also importantly, movement of humanitarian staff who still need to be located in difficult areas, in hard areas, some of whom were trapped outside. I can tell you that almost 400 humanitarian development staff were trapped outside their areas of operation. UN is working to bring all of these back to their locations to continue to provide service to needy individuals, needy communities, particularly IDPs. So
let me bring in Comfort Aero on this point. Comfort, are you heartened by what you're hearing from Mohamed Mchambas in terms of the region and the continent picking up the slack for and helping out the UN?
Yeah, I mean, I do think it's worth noting that what is striking in West Africa, and I would say in several other parts of the continent, and also at the African Union, is that we have seen some leaders move with urgency to cooperate on this pandemic. They haven't all necessarily waited for outsiders, for the international community to come in, except for the question of debt relief. I think there have been lessons learned from West Africa's Ebola crisis. The creation, for example, of the African Center for Disease Control was as a result of the Ebola crisis. That center now that is based in Addis is playing a leading role and has transformed the African Union's response. It has been working with the WHO since the cases began breaking out in China. The realization that, and being able to see and act in advance of what was happening in China and Europe. I also should say that the CDC has also helped coordinate response, but also has provided a lot of information and support to member states, African Union member states. And it's also developed guidelines for how member states might put in place social distancing, how to monitor, how to adapt quarantine to specific needs. So there has been some very quick responses that we haven't seen before by the continent. And I also should add that another significant actor in all of this has been President Cyril Ramaphosa in his capacity as head of the African Union this year, who has coordinated an Africa COVID fund response as well. and has also worked to mobilize the private sector, and they're looking to raise around 550 million. So I do think it's worth recognizing what's happened at the continental level and at the West Africa level. Now, the key issue, to go back to what Dr. Chambers was saying, is whether we can sustain this cooperation and making sure that we do have some kind of COVID coherent diplomacy and the sharing of information, of data and responsibilities. And
whether we can sustain it, that depends on resiliency. It brings us to the second part of our conversation. And before I bring in Patrick Smith, let's take a quick snapshot of a couple of places. In Benin this week, they reopened schools, except for kindergartens and universities. And there it's a question of easing a lockdown in a country that really is so dependent on trade, on exports, on the port of Cotonou. In neighboring Nigeria, that beginning of the easing of lockdown began last week in the largest city, Lagos. There's a sense of, partial relief on that score. Haxie Myers-Belkin filed this report last week.
After 5 long weeks of lockdown, this Lagos grocer's is relieved at a partial return to normality.
Yeah, I'm sweeping. Trying to clean everywhere.
On the 30th of March, businesses across Nigeria's busiest centres were forced to close as people were ordered to stay at home. Now this shop and many like it have been allowed to reopen between the hours of 9 a.m. and 3 p.m.
Us, we sell perishable goods here, so we need to open every day. So for you to lock down for weeks, then that's quite a big issue for us. But thank God for us reopening again.
There are more people out on the streets, but the prolonged lockdown has left many out of pocket.
People have exhausted all the money they have. That's why everywhere is dry now. There's no customers.
Meanwhile, ongoing coronavirus measures continue to have serious implications for the country's informal jobs market. Rickshaw drivers, for one, have been told they're not allowed to carry more than 2 passengers at a time.
It's not really a good thing carrying 2 passengers because we are not going to make up to the money we are making before.
Elsewhere, street vendors are spying an opportunity, with homemade face masks now joining snacks and drinks as travel essentials. Nigerian authorities are calling this stage 1 of lockdown easing.
Mohammed Ibn Chambas, I spoke to one entrepreneur in the transport sector. He's from Benin. He said, we've only had 2 deaths. If this goes on till beyond June, the economy is going to be completely crippled.
There's no question that the economic impact is going to be severe. We've seen all the revised figures for growth, projections, both country level, but even regionally. If you take the case of Nigeria, which is 75% of the regional GDP, Nigeria is projected now to grow at 1.5%, but some even think it could be much lower. So consequently, this impact will be felt across the region. As we say, when Nigeria sneezes, the rest of the region catches a cold. But with commodity prices collapsing and the usual vulnerability to external shocks that are being felt, supply chain disruptions, there's no question that the region will. And that is why the Secretary General has been very insistent that the international community has to be mindful of this and consider debt relief, which has been granted to some countries. We still believe that debt relief should be considered for those countries that were excluded in the relief granted by the G20, namely countries in the region such as Cote d'Ivoire, Ghana, Nigeria, Cape Verde, which are sort of middle-income countries. So these also should be given some relief because of the severe impact of the virus on the economy and other development aspects of society.
Yeah, right now it's just a debt freeze. Patrick Smith, two issues with that. Number one, a lot of the debt is private debt. And number two, how are the Chinese going to play it?
Well, on the private debt, there's a really interesting initiative launched by Tijan Cham, the former CEO of Credit Suisse, who's now part of this African Union team, to try to renegotiate some sort of restructuring of the debt. And Tijan and Vera Songwe from the Economic Commission of Africa are putting together this plan to launch bonds, like the Brady bonds were launched in the 1980s. These would be guaranteed probably by the IMF and the World Bank, in which the outstanding African commercial debt could be converted into tradable instruments and taken off the books, both of the governments and of the banks that issued them. And that the advantage of that is that it's not a reneging in any way of the debt. The debt is still valid, and the African governments that have contracted this debt still have to pay it to the commercial holders. But it frees up the financial system. In the 80s, the government, U.S. government under Ronald Reagan, did this, and it really sort of freed up the financial system in Latin America, and a few African countries joined that. I think Nigeria was one of them then. So that's a very important initiative. On the China side, this week, in fact, the Chinese African envoy gave a press conference yesterday in which he said for the rest of the year, they're prepared to, China is prepared to do a debt standstill for all the African debtors. And that's on a sum of around $150 billion owed by African states to Chinese institutions such as the China Development Bank and some of the big mining and transport corporations in China. So I think things are moving in the right direction. They're just moving far too slowly.
And among the points brought up, Véronique Tadjo, in that open letter that you penned along with a whole host of other intellectuals from across the continent, is a call to break with, quote, the vicious cycle of indebtedness on the continent. How do you turn this crisis into an opportunity?
Well, I suppose by rethinking Africa, no less. I think it's some people. I have heard that a tragedy is a tragedy if it doesn't lead to something else. That means that we cannot continue in a fatalistic way, because I think we have a lot of human and economic resources, and we know that they have been under exploited. So we need to rethink so many things, including communication, as I said earlier. I mean, it's fantastic to hear about everything that has been done to alleviate the situation in which many countries, African countries, find themselves. But is there a way of communicating this to a wider audience? Because we have the impression that there's the economists on one side, the politicians on the other side, and most of the time we don't get to hear as much what is happening.
Yeah, the messaging in a public health crisis is so essential, and that because you need public trust to get over a pandemic like this one. Let me ask you, Mohamedine Chambas, there are local elections still on the cards for this Sunday in Benin. Should they be holding elections in the middle of a coronavirus crisis?
I have, together with my colleagues in our office, had discussions with Benin authorities, including the National Electoral Commission. One of the aspects to this is the fact that Benin has been rather strict in observing constitutionally mandated timelines for holding of elections. And that is positive because we often have problems in many countries where these constitutional deadlines are not respected, creating a lot of difficulty, including sometimes crisis. So to that extent, it is good. Secondly, there has been deep consultations among the political actors in Benin. This is something that the UN, the ECOWAS, indeed the AU have insisted on, that in these times of crisis, any such major political activity should enjoy an inclusive and thorough consensus among all political actors. And that seems to be the case this time. Now, this is significant given that the last elections in Benin, the legislative elections, did not enjoy such a consensus. As a matter of fact, they were quite troubling in this, as many major opposition parties were left out. The local and municipal elections are creating an opportunity for them to come on board, for them to be able to contest and hopefully begin to have some role in local and municipal levels. So these
and
are
it's
all,
not a public health risk.
There is a risk there. There's no question about it. What we have been assured is that measures have been put in place to ensure physical distancing, to ensure that masks will be worn, and these, in fact, will be provided. 12 million masks have been imported into the country. There will be no public campaigns. Arrangements have been made to ensure equal time for all parties to use media to canvass their candidates. So some mitigating steps have been taken. I should say that one would have wished that elections would not be held under these circumstances. But given the particular case of Benin and the fact that the opposition was left out of the legislative elections, I think it's a good step that they have an opportunity to contest in local and municipal elections, elections which also, by the way, will allow them to position themselves for presidential elections, which are due next year.
Patrick Smith, there's no easy answer to the question of whether or not you stage elections. We saw back in March what happened in Guinea, where there were a lot of people cried foul. Same thing in Mali. Let me ask you though, because we don't know how long this pandemic is going to be around. There are big elections in places like Ivory Coast, Guinea, Ghana before the end of the year. What do you do?
I think it's a very tough decision. To some extent, you're damned if you do and damned if you don't. And I think the Guinea elections, particularly the context of those elections, essentially approving a referendum on a new constitution, which was to give the incumbent leader, Alpha Condé, another term in office. In fact, several more terms in office if he chooses to exercise those rights that the new constitution has given him. And as you say, you've got very important elections coming up in sort of two of the biggest economies in West Africa, Cote d'Ivoire and Ghana. And I see already on the eastern side of the continent, President Museveni has said it would be absolutely crazy to have presidential elections during a coronavirus pandemic. So he's already stated his case, and his elections aren't even due till next year. So it does raise some difficult cases, and there's a constitutional issue. I mean, in Ethiopia, the opposition are saying that the Prime Minister Abiy Ahmed has railroaded through a new law in Parliament with using his parliamentary majority to extend his tenure past August, when there were due to be held elections. So I think the only way to make this work, I think, is there's got to be a real working consensus between the ruling parties and the opposition parties that if for public health reasons, for the very good public health reasons of not running big political campaigns where hundreds of thousands of people gather and interact with each other and sort of contradict the social distancing rules, if it's decided that they should jointly then agree on a new schedule when the public health risks can be diminished. But it would mean the ruling parties have to have the confidence of their opponents and decide on a new timetable if it's going to have legitimacy.
Comfort Arrow, let me ask you, because has your research found what Patrick is describing, that rulers with a more authoritarian bend are cherry picking where they so desire, so that this crisis fits their needs?
Absolutely. I mean, I think Patrick described it very well, and I'm glad you extended it to other parts of the continent. Patrick, I would have added Burundi to your list as well, which is going to elections next year, but closer to, next week, sorry, but closer to home, you've got Burkina Faso also will be going to elections, and Niger, and again, with or without the COVID crisis, you already had tensions there between the opposition and the ruling party. You already had a very volatile situation in the country with security. I mean, I think this does play well, Francois, as you say, for some authoritarian leaders. For instance, Alpha Condé, he was able to resist the pressure from traditional Western countries, from the European Union, from the US and France, because he was backed by Russia, Russia issued a communique arguing that the vote that took place on the 22nd of March was not a bad vote. So the pressure on, by traditional partners for more democracy, more human rights, more good governance, is more and more difficult to maintain, because there are a multitude of choices now that African countries face in terms of how they want to spin the decision to hold or not to hold elections. I think the biggest test, to go back to what Patrick was going to say, is the transparency in the decision that is taken by leaders, is the ability for those leaders to consult and make sure that they bring the opposition on board. But it's not just the opposition, it's also bringing civil society on board. And in a context where you've got violence and where you've got jihadi attacks and attacks by other non-state armed groups as well, making sure that you've got an enabling environment for those elections to take place is going to be crucial as well. So, as I was saying, regardless of the COVID pandemic, we're already in environments that are very tense, there's a lot of insecurity, and there was already a question mark about the ability to hold those elections in those societies as well.
We're almost out of time. Véronique Tadjo, very, very briefly, I know in your novel about the Ebola crisis, which in French is called In the Company of Men, you call there for, can I call it a coalition between humans, animals, and trees to take on the pandemic? There has to be a holistic approach that's African, you're saying.
Yes, absolutely. And I think that with colonization, we have lost a lot of our beliefs. And if we take a religion that has been damned too often, animism, you can get a new direction in terms of how we view nature and how we can relate in a more balanced way to nature, to the animals, and to everything that surrounds us. I think we have to see the continent in an holistic way, and that's what all these epidemics and pandemics show us, that there is more than just one issue at a time.
All right, from the grassroots to UN headquarters in New York, it has to be a complete approach. I want to thank you so much, Véronique Tadjo, for joining us from London, Comfort Arrow in the UK capital, Patrick Smith, Mohamed Chambas for being with us from the Ghanaian capital, Accra. Thank you for joining us here for this edition. There's much more on our website, france24.com. You can also subscribe to our YouTube channel. Bye for now.
Every year, North Korea sells expensive fishing licenses to hundreds of Chinese trawlers to fish along the North Korean coastline.
它这个船要分给什么呢？下面比如说部队的，党政机关这些部门的，因为他都没有钱，就爱拿这个去卖钱的。朝鲜没有个体。
By By selling its fishing resources to China, North Korea brings in much-needed foreign currency, officially denied it by the sanctions of 2017. The less fortunate North Korean fishermen are forced to risk their lives in makeshift boats, venturing into Russia's territorial waters to catch fish for sale back in China. Over several months, our reporters tracked these poachers of the world's most secretive country, seeking to understand why this shadow armada is invading the Russian Far East. We bring you results of their investigation. Unprecedented images from Vladivostok to the edge of North Korea.
Reporters Plus on France 24 and France24.com.
France 24. Every art form.
Liberté, égalité, actualité.